Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's great to be back here with you again, although I guess I wasn't gone last week. I didn't take a week off between the 2 months as I usually do. So anyhow, good to be with you here tonight. I'm looking forward to see what you have in store with me in terms of your questions. As you know, you create the webinars with your questions. So none of these webinars is ever the same. For those of you that are coming back, I see a number of new familiar names on my board. Great to have you here. And for those of you that are new, welcome. I hope you get some useful information out of this tonight. There's a couple weeks or a couple ways that you can participate in the webinar. One is to see the questions that other people post and the responses that I give to them. If you happen to be in the live version of the webinar, you'll actually get to read those questions on the bottom of your screen. If you're in the recorded version, you actually have to hear me read the questions. So I will be reading them out loud. The other way you can participate is to just go bold and write a question to me. The way you do that is in the chat box down on the right-hand side of the screen. Be aware that when you write your question and you hit the enter key, it actually sends whatever you've written to me. So I prefer that you write your whole question as one big, long, run-on paragraph. And only hit the enter key when you hold the whole thing complete. Otherwise, it gets to be kind of complicated for me to find the various parts of your question from my side here. Okay. All right. And then tonight, I am creating a recording of tonight's webinar as I usually do. And so I hope that I hope to get that edited up and a summary of it written for you tonight so that we can get that out to you first thing in the morning. Okay. So it's usually somewhere around 9 to 9:30 a.m. When you actually do get that email, there'll be a link to sign up for next week's webinar as well, too. And then just one other thing. Let me make sure that everyone, all right. Yeah, okay, so no one's complaining if they can't hear or see me this week, which is good. I'm just going to give you a quick pitch here, though. If you like what we're doing here in my Lyme webinars, the information you get here, you'll probably really like my new community, which is called LymeUNITED. And so you can take a look at that at treatlyme.net. There's a tab there called LymeUNITED. It's an online support community that is supported by me. So compared to Facebook groups that many of you may participate in, you actually get some of my expertise as backup. There's a lot of input from our knowledgeable members as well, too. And so I hope you'll check out our page there and see if it's right for you. And if you want to become part of our community, we'd be glad to have you too. All right. So without any further ado, let's go ahead and get started here. There we go. Hi, B. Let's see. Which infection is this characteristic of? Excessive sweating, drenching, only during the daytime, have to change clothes constantly, and a 20-year-old, so not related to menopause. So the one infection that often gives a lot of excess sweating is Babesia, and it tends to be night sweating, though, not always daytime sweating. Sometimes Bartonella can give you daytime sweating, though. So to see which of those you might have, I would suggest that you look to see if you have any of the other symptoms of them. Okay, so Babesia symptoms are the following. So you can have night sweats, typically, sometimes day sweats, but night sweats, air hunger, which is a feeling you can't get enough air from time to time. Also, having headaches, frontal headaches is quite common. Migraines can be there sometimes. Sometimes people with Babesia have very frequent episodes of deja vu experiences. So they think that this has occurred to them multiple times, even in a week or even in a month, for instance. Okay, so that is an interesting symptom. Other thing people can get is a lot of dropping of their blood pressure spontaneously. So when they stand up, they get dizzy and lightheaded easily. And then sometimes people with Babesia have a lot of skipping around of their heart. Of all the infections, Babesia tends to be the most fatiguing as well, too. Okay, all right. Then the other possibility with the day sweats could be Bartonella. And Bartonella is known in addition to giving day sweating, although not quite as heavy as you're describing, but possibly. Okay. Bartonella is known for giving a lot of pain on the soles of the feet. It also has associated with it having a lot of neurologic agitation, and that can show up as tremors or shakes, muscle twitching. There can be nerve injury giving you either numbness, or it can give you nerve pain. The other thing, you can get agitation of the psychiatric system, so you can get a lot of ongoing anxiety, sometimes depression, sometimes hallucinations. And the more interesting quality of Bartonella is that sometimes it gives people a lot of internal vibrations, a feeling of vibrating or shaking on the inside, okay? So those are some things that might make you think of Bartonella, and also extreme cognitive or thinking problems, okay? All right. So, but when I hear of excessive sweating, even if it's in the daytime, I'm leaning more towards Babesia, especially if you have a lot of those symptoms that I just described that are Babesia symptoms. Sometimes, though, again, as I said, it could be Bartonella. All right. All right. Good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. I don't know if you have any knowledge of Microgendex, but they use DNA 16S sequencing and can uncover infections standard labs can't. I use them for chronic UTI and vaginal infections. Recently, my results came back with the top 2 bacteria being very obscure at high load. Normally, I have E. coli and Enterococcus. The top bacteria is multi-drug resistant and would require IV or IM carbapenem to treat. There is 2 camps on chronic UTIs. One says that they are embedded infections, and the other says they aren't, a bit like the Lyme wars. Some feel Microgendex picks up everything, and these bacteria can be found in bladders of asymptomatic people. Do you think I should treat these bacteria? I have taken so many rounds of Augmentin and Macrobid for E. coli and Enterococcus, which Microgendex shows, but they never really go away. My diagnosis is interstitial cystitis, but many feel that it's a wastebasket diagnosis and the cause are these infections. What, if any, are your thoughts on this? I'm considering doing. All right. Gail, I'm not familiar enough with Microgendex to be able to make a comment as to whether they're valid. Okay, so I just want you to know that to begin with. I don't know whether their testing is valid. All right, so I don't know about that. In terms of, there are some people that that do have problems with having ongoing colonization of their bladder with various organisms, and that sounds like could be your situation. What I prefer to do in those situations is make sure that we're maximizing preventive measures. Okay, so that means frequent urination, so drink enough to pee halfway frequently. After sexual activity, make sure that you pee right then too, so you're washing out the bacteria. And then taking people that get a lot of bladder infections tend to have stickiness, if you will, of the bladder to attach to the urethral lining, so the tube that comes out of your bladder. And there is a, I'm kind of blank on it right now. There is a sugar substance that you can take that when you take it will help prevent the attachment, okay? And hopefully that comes back to me later during the webinar. Don't worry, my brain will keep working on it. But I'm blanking on that right now. Anyhow, as to whether you should treat and with what, I would need to know a lot more about what your symptoms are. And again, I need to understand whether I consider that lab to be valid or not. So I'm not going to be able to give you a comment on that, unfortunately. Okay. And then in turn, bear with me. I'm just going to look something up here real quick. Let's see. Oh, that's right. Okay, so the sugar is called d-mannose, and it's something that you could take to actually limit the stickiness of the lining of your urethra, the tube that comes out of the bladder, so it's not going to tend to hold on to those bacteria as much. Okay, all right. Good luck to you, Gail. Hello, Scott. Hi, Dr. Ross. Can you provide recommendations of good Lyme-literate doctors who offer telehealth services for non-local patients? I've been suffering with severe disabling muscle pains for 2 years. I have had positive and negative Lyme and Bartonella tests since 2020 or since 2023. I had a tick bite round red rash 5 years ago. I have not responded to treatments by my local clinic in Ontario. They are confused regarding my case, diagnosis, and their Lyme expertise seems limited. I have been self-treating with your herbal protocols for 2 months with no improvements. I believe I need one-to-one assessment with a more experienced doctor than is available to me locally. Any suggestions? So there is one physician that I'm aware of that would be, that I believe still is doing telemedicine, but she would need to see you for an initial visit first. And then after that, she could do telemedicine with you, even being up in Canada. Her name is Dr. Jennifer Letitia. That's Letia. And she is in Fairfield, Connecticut. That is the only person I am aware of that is doing it cross-border for Canadians. There may be others. It's just the only one I'm aware of. Okay. But again, she has a requirement that she sees you for a first visit in her office, though. Okay. All right. Good luck to you, Scott. Hello, Shanna. Let's see. Hi, Dr. Ross. Why isn't taking both Japanese knotweed and Cryptolepis concurrently for Bartonella redundant? Good point. So Japanese knotweed is an herb that can treat both growing and hibernating, or we call hibernators, persister Bartonella. It also has the ability to treat growing and hibernating Borrelia or Lyme as well, too. All right. Cryptolepis can treat Babesia. It can treat growing and persister Borrelia with Lyme, and it can treat growing and persister Bartonella as well too. All right, now is the issue that we find in so yes, both knotweed and Cryptolepis would be presumably targeting the same way. But they have different mechanisms of action. They work different. They kill in a different way. So when you take the two of them, you're getting added benefits of how they attack the germ. We often find in Bartonella that your best way of recovery is to take at least 2 things, sometimes 3 things. And that could either be prescription or herbal antibiotics or both. Okay. But taking at least 3 things seems to give us some of the best results. I'm sorry, 2 things seems to give us the best results. Sometimes we'll go to 3 things. Okay. All right. Good luck to you. Hello, Terry. Let's see. My son was just diagnosed with an isolated B. recurrentis. Have you seen this before? Is there a chance he has another Lyme strain and it didn't register? So I don't know. What I would need to know also is, even though he tested positive for that, keep in mind tests can be wrong. All right. So to say whether he actually has it, I would want to know if he has a number of symptoms that suggest Borrelia of any kind as well too. So fatigue, body pains, thinking difficulties. I would need to know more. Okay. So if he has enough symptoms and he has positive testing, you would say, yeah, probably is something that is giving him problems and causing disease, not just infection, but disease. Okay. All right. Anyhow, I don't know if that answers your question entirely, but those are my comments on it. Okay. All right. Good luck to you, Terry. Lisa says hello, and thank you for helping our Lyme community. You're welcome, Lisa. Thank you for the comment. All right. right, let's see. Hello, Brandy. Let's see. Which infection can cause a lot of heat, burning rash, and dandruff from the shoulders up? I feel like my head is always about to explode. Docs always want to say eczema, psoriasis, seborrheic dermatitis, blah, 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 blah. Guessing catch-all. So when I hear that there's a lot of rash and also dandruff, that dandruff is also known as something called seborrhea dermatitis. Okay, it's the same thing. And if you have a lot of it, it can give you a lot of flakiness and it can give you a sense of burning because there's all this inflammation going on from it. All right. Infections that suppress your immune system sometimes can lead to more seborrhea dermatitis. But also what I have found is if you have intestinal yeast overgrowth, it tends to make the problem worse. All right. So if you're predisposed to being a person that can have seborrhea or dandruff, if you then develop too many yeast in your intestines, it can make the skin problems worse. And so what happens is when you have too many yeast in your intestines, and they could overgrow, if you're on either herbal or prescription antibiotics, there's a chance that they could overgrow. All right. And so what happens with too many yeast in the intestines, not only do they trigger too many cytokines, and those inflammation cytokines that also get triggered by Lyme, that also get triggered by having mold toxicity, those increased cytokines give you a lot of what we call the Lyme symptoms. So, your fatigue, your cognitive dysfunction, your body pains, your hormonal dysfunctions, your sleep dysfunction, that's all cytokine related. Okay. So intestinal yeast can lead to that too. So a typical story might be you're treating somebody and they're doing better, and then suddenly they get worse. Well, think about intestinal yeast being under that. Okay. All right. But the second thing that can happen is those intestinal yeast, when they grow too much, release toxins. And those toxins get absorbed into the bloodstream and will interact with the skin in people that are predisposed to make any skin problem worse. So it could be pimples or acne. It could be eczema gets worse. It could be psoriasis gets worse. And it could be dandruff gets worse. Okay. So if I've got somebody in my practice that's been having a lot of time problems with breaking out with seborrhea, I'm going to start thinking about looking for intestinal yeast overgrowth. And the questions I'm going to look at is there any increased sugar cravings? Or if somebody has sugar, do they get a lot worse? Or before their skin started breaking out really badly, did they go on a sugar eating binge at Halloween, for instance? All right. Did they feed their yeast? Other symptoms I'm going to look for are skin changes, like we're talking about. I'm going to wonder about, is there any intestinal gassiness or bloating? And then in females, I'm going to want to know about, is there any vaginal itching or vaginal discharge? Okay. All right. So see if you say yes to a number of those questions. And if you do, then I would look at treating for intestinal yeast overgrowth. All right. So let me do a quick screen share here for you. All right, so this is my online Lyme guide, and take a look at my yeast chapter here. And you can see there's two articles. One is, or that pertain to you. There's this one called A Silent Problem Is It Yeast, where I review how do you figure out if you might have too many yeast. And I also review the problems that too many yeast give you, okay? The second article over here is Kills and Prevents Yeast, A Brief Guide. I review both herbal and prescription options to help with recovery from intestinal yeast overgrowth. Okay. All right. All right. Thanks, Brandy, for that question, and good luck to you. Let's see. All right. Oops. Darn it. I just just accidentally deleted a question here that I was trying to post. So whoever I deleted, I'm sorry. I can't even remember who the name was. I was just getting ready to post it. And I was starting to read it at the same time. So I apologize. Anyhow, let's go. Let's try this next one then. There we go. Hello, Sandra. Let's see. Hi, Dr. Marty. Thank you for your help. I currently have Bartonella, Babesia, and Lyme, current and or long-term, not sure. I'm on 1.2 teaspoons of Mepron to start and cannot tolerate it. I get bluish lips, aches, chills, etc. Also on minocycline 50 milligrams to start daily. I'm having difficulty. Is there anything easier to tolerate than Mepron? I'm trying it a bit longer, a good idea. Also, is 50 milligrams minocycline enough? Thank you. All right. So, Sandra, to say if it's, in determining what levels to give you, I would need to know a little bit more history about whether you're a person that tends to have a lot of sensitivities to medicines or even food as part of your Lyme disease, okay? And if you are, then I always err on the side of starting with low doses, all right? So a typical dose that I like to put somebody that can tolerate medicines on minocycline is 100 milligrams twice a day. But if you are medicine sensitive, in that case, I would start at probably 50 milligrams a day, see how you tolerate it. As the Herxheimer reactions go away, then I might gradually try to work up to 100 milligrams twice a day. Okay. So anyway, I need to know more about how you are in reactivity to medicines and even food. Okay. To give you an accurate recommendation on the minocycline dose. Now, I'm just looking back here. So with the 1.2 teaspoons of Mepron, you're getting bluish lips, aches, and chills. I haven't seen Mepron lead to bluish lips before. Bear with me. I want to look at one thing here. So there are some medications, and I'm just searching it out as I talk with you here, that can lead to a condition called methemoglobinemia, which would give you the blue lips. Hold on, I'm looking up to see if Mepron can do that. All right, let's see here. Well, don't worry, I'm still looking. I probably should have thrown it up on the screen so you all can see it too. All right, yeah. There are some people that get methemoglobinemia on it. Okay. All right, I'm looking at the package insert and where they list different side effects that some people can get. And there are some people that can get this condition called methemoglobinemia. All right, so let me talk about that real quick. So the part of your red blood cell that carries oxygen is the hemoglobin. And there are some people that are set up so that they can develop methemoglobinemia either whenever they're under severe medical stress or when they're on certain medications. And what happens in methemoglobinemia is that your hemoglobin has a hard time releasing oxygen when you're on Mepron, for instance, all right? And because it can't release oxygen, parts of you will start turning blue because they're not getting enough oxygen, all right? So you need to reach out to your healthcare provider and let them know this is happening. They have a couple options. One is just to not use that medication with you and consider looking at other options to treat your Babesia. But the other thing that they could do is add in medication, which is called methylene blue. They would have to have it compounded. You can make it in an oral form. Methylene blue can help treat methemoglobinemia. It basically makes it so that hemoglobin bumps the oxygen off, frees up the oxygen, okay? There's another advantage to doing methylene blue, and that it is also been discovered to be antibiotic against both Bartonella and against Lyme. It can treat growing and persister forms of both of those germs too. But you need to talk to your healthcare provider to see it, let them know things are turning blue. All right. And that I would have a concern that means methemoglobinemia. And that may mean either starting methylene blue along with what you're taking, or it may mean looking at a different agent to treat your Babesia too. Okay. All right. Good luck to you. All right. Hello, Douglas. Let's see. Oh, I guess we already answered that earlier. Oh, no, this is a different question. So Douglas wants to know, is this overkill for Bart, Babesia, and Lyme? Chinese skullcap, Japanese knotweed, Houttenia, and cordyceps, sweet Annie, cat's claw, teasel, and Cryptolepis. That's a lot of stuff. So the cordyceps, I would not call antibiotic. The cordyceps is going to help your immune system, but I would not look at it as actually killing. Okay. The skullcap and the knotweed and the Cryptolepis all can treat growing and persister Lyme, growing and persister Bartonella. And okay, so you got yourself covered just with those three. The Cryptolepis would be treating Babesia. It's not, so this is a lot of stuff you're taking. I would suspect you could turn it, save some money and still have good effectiveness and not have trouble with side effect potential by decreasing back to the skullcap, the knotweed, and the Cryptolepis. And you have good coverage for all three germs. You can stay on the cordyceps too, because that's helping your immune system work better. Okay. All right. That would be my thought. If you're asking, can you tailor this back so you're not taking as many things? That's what I would recommend. Okay. I don't know if you take all these things if you're going to hurt yourself, but the more things you take, the more chances you have of hurting yourself, even if they're plants. Okay. All right. Good luck to you, Douglas. Hello, Mimi. I say hi, Dr. Ross. Thank you for offering this invaluable forum. You're welcome. My 86-year-old friend has had Lyme disease from Borrelia burgdorferi for almost 3 years. He has no underlying conditions, has been plant exclusive for over 30 years, takes no meds, and in fact is in perfect health save for Lyme. His Lyme-literate doc in Connecticut put him on a pulse protocol of doxy, plus tetracycline, and other antibiotics, which he followed diligently for about 8 months with no relief. The only time he felt slightly better is when he was on an herbal regimen. His main complaint is that he has flu-like symptoms and burning sensations in his entire body. He says it feels like Brillo. He is now under the care of a naturopath who prescribed Cowen for Lyme. What do you think about Cowen, and what can my friend expect? Thanks. Let's see. So he's got Borrelia. All right. So first of all, whenever you treat Borrelia Lyme with either herbal antibiotics or prescription antibiotics, not everything works. All right. So if I put people on 2 antibiotics for Borrelia and we're sitting at about 6 months or more into treatment and we're not making any headway, then I want to change to different agents. Okay. So he could have changed to 2 different prescription antibiotics, for instance. Okay. Or it's fair to say, let's change to herbal antibiotics. And that's fine. If I look at Borrelia, just the Borrelia germ, not Bartonella, not Babesia, but for Borrelia, in my experience, regimens that involve prescription antibiotics have as great of a chance of working as herbal antibiotics. Okay. Now that doesn't mean that in a person, herbal antibiotics will always work, but on the whole, what I see on average, they each, the prescription antibiotics versus herbal antibiotics stand reasonable chances of helping, about equal chances of helping. Okay. All right. So if, by 8 months he's got no benefit, then it's time to start thinking about making a change, going with a different regimen. Okay. Second point. This idea of pulsing doesn't always work in people. Some people respond better to continuous doses of antibiotics. All right. And in fact, in my experience, the majority respond better to continuous rather than pulse doses. So it could be that the problem is that the pulsing of the antibiotics was not the right way to go. All right. Now, Cowen protocol. With Cowen, he's gonna be on a rotating group of antibiotics. Eventually, they're going to work. They're initially going to work. The killers that he will initially be on are Cemento, which is their version of cat's claw, and something called oh god, I'm blanking on what they call their otovaquone. But anyhow, they're going to be on 2 herbs that have names given to them by nutrimetics, and the 2 main killers are, the generic would be cat's claw and otova. All right. And after a couple months after they've worked up on that, then he's going to pull those away and he's going to rotate in some other herbal antibiotics. Of all the antibiotics that are used in the Cowen protocol to treat Borrelia, the 2 that are really effective are the otova and cat's claw. I don't find benefit for most of the other antibiotics that are used in the Cowen protocol. I just don't. Okay. Your naturopath may have different experience with that, but that has not been my experience. Okay. Cowen also will rotate in the Houtenea as part of treating Bartonella, but beyond that, he's really weak when it comes to treating Bartonella. And his protocol is really, it just practically has nothing that's going to be effective in it against Babesia. So if your friend has a Bartonella and Babesia, that is just not a way I would go. Anyway, those are my thoughts. I think there's better herbal protocols out there. You could take a look at my Ross Lyme support protocol, where I work exclusively with non-rotating otova and cat's claw. And then also I work with cinnamon clove oregano in there that helps get at treating persister and biofilms. All right. So Borrelia, Lyme, exists in 3 forms. It exists as a spirochete. It exists as a form that sheds its covering and moves inside of cells, or we call that the L form. And then it also has a microscopic cyst form of the germ. All right. So the other thing it has is those forms can either be growing or they can be hibernating, or we call those persisters. And we think it's the persisters that people will develop after they've been on antibiotics for a while, whether it's prescriptions or herbal, that make it difficult to get rid of Borrelia. All right. Now, maybe 10% of the germs or so become persisters, but we want to cover for that. The other thing that makes Borrelia difficult to treat is it has the ability to develop a slime layer that covers the germ. It's a sugar slime layer that's held together in a protein skeleton made up of the blood clotting protein called fibrin. All right. And so we want to break that down too. And the oregano, cinnamon clove, or the cinnamon clove oregano capsules that I talk about in the Ross Lyme support protocol, they have a way of breaking down those biofilms as well too. All right. The other problems I have with Cowen is Cowen does not do a good enough job at supporting the whole person. So things that need to be addressed are sleep. A person also needs to take things that are going to lower the infection, inflammation. Those are chemicals called cytokines. A person should also take things that support the adrenals and the thyroid. A person also should be on a good multivitamin, etc. All right. So Cowen is not a full-scale protocol as far as I'm concerned. So let me just do a quick screen share so you can see the Ross Lyme support protocol, which I think is a more effective way to start and go at this. All right. So let me do a screen share here for you. All right. So this is my Treat Lyme by Marty Ross MD website. All right. And take a look at my Lyme protocol tab over here. And in here, I address the things that all protocols that treat Lyme should address. All right. So first of all, we want to make sure a person is getting enough sleep, 7 to 9 hours of sleep. And in here, I describe ways to do that, both herbal and prescription. We want to make sure that person is on primarily a plant-based diet. And at the beginning, I like that to be a plant-based paleo type diet because it supports your energy factories called mitochondria. It also is rich in fiber, so it'll make it so that your intestinal germs are not going to tend to get yeast as easily. Okay. Also, and there's a diet that supports your, as I said, the mitochondria. Okay. I like to have people on things that are going to lower their inflammation cytokines. And in this protocol, I recommend either curcumin or a combination product, which is called cytoquel. Okay. I like people to be on something that's going to support their adrenal glands called ashwagandha. I suggest people take a good multivitamin. I like people to be on glutathione to support detox. When people are able to, when they finally start getting some recovery, I do suggest exercise, but in a way that will not knock you down. Okay. In terms of immune boosters, I don't recommend any because actually getting sleep, lowering cytokines, detoxing, being on ashwagandha, fixing hormonal problems, and treating your infections is what's going to turn your immune system back on. All right. I always recommend that we look initially to make sure people don't have too many yeast in the intestines because, again, those yeast turn on and cause too many cytokines. And then finally, in my protocol, I give you recommendations about herbs and also prescriptions that you might use to build a protocol. Okay, so if you were to look at this one, option 1, it uses otova bark, cat's claw, and the cinnamon, clove, oregano that I was just describing. Okay, all right. All right. Very good. Mimi, good luck. I know that's a lot, but take a look at the Ross support protocol. I try to explain why I recommend each of those things. I don't find Cowden to be thorough enough. And frankly, I don't agree beyond the herbal antibiotics of the Atoba and cat's claw that the other antibiotics that are part of that are really that effective. All right. All right. Good luck to you. Good luck to your friend, actually. All right. Hello, Terry. Let's see. Thank you for sharing your knowledge. You're welcome. Starting over with everyone in one comment. My son was just diagnosed with isolated recurrentis again. Let's see. Have you seen this before? Is there a chance he has another Lyme strain didn't register? His identical twin had the same strain with Bieber-Dorferi, OSPE, and OSB. His doctor is unsure of how to treat this. He can only find journals on acute cases. What kind of treatment do you recommend for a recurrentis only strain and for how long? Acute literature is showing 3 to 14 days. His doctor would love to discuss this with you if you're unable to answer this here. And answer your question, yes, he has severe fatigue, chronic joint pain, osteoarthritis, brain fog, and GI issues. He struggles with heat and light intolerance. He is 25 years old, and the symptoms seem to trigger when he went through puberty. All right, hold on. I have to look up one thing here. Okay, got it. So it's one of the what is known as tick-borne relapsing fever strains. All right. And generally, tick-borne relapsing fever in most people does not become a chronic infection. Now, we are starting to wonder, there's newer data that comes out and says that it could become a chronic infection, giving you symptoms that are similar to Lyme disease, chronic Lyme disease symptoms. My approach, whenever I get somebody that has a positive symptoms, and has what I would call Lyme symptoms, the fatigue, the joint pain, brain fog, GI issues, is I would probably initially try to put him on a 3 to 4 week course of doxycycline, 100 milligrams twice a day, and see, is that enough to get him better over the course of a month? Okay. If it is not, then let me see, did he test? If he is not, I would want to make sure that you all did thorough testing with IGeneX. Looks like you might have here, to look at the immunoblot test from IGeneX that looks to see whether he also has a chronic Lyme disease strains. There's 8 different strains of Lyme that can infect a person. I would look at getting the immunoblot for Bartonella through IGeneX, and I would look at getting the immunoblot for Babesia. In other words, I am of the school of thought that the people that still test positive for the relapsing fevers, Borrelia, I think that generally it's pretty easy to treat. And if they are still having symptoms, I'm more of the school that they might have Bartonella, Babesia. All right. So I would like to see what those results are on those as well, too. The reason I would suggest the immunoblot testing through IGeneX is IGeneX is looking with their immunoblot to see if somebody might have one of 15 strains of Bartonella or one of 15 or 20 strains of Babesia. And the way they do that is they're looking to see if you're making antibodies against a marker that is found in all Bartonella, the whole family of Bartonella, and in the whole family of Babesia, for instance, okay? And we recognize that there are probably 15 strains of Bartonella that can infect a person. IGeneX is the only lab that's doing an antibody test that will look to see if you have one of those 15 strains, all right, by testing for the whole family. Babesia, same thing. They're the only lab that's looking to see if you have the broad range of Babesia infections, all right? So in a situation like this, if your son was in my practice, I would go with 3 to 4 weeks of doxycycline, see where he gets. If he's not getting adequately well, then I would look to repeat immunoblot testing for Bartonella, or do Bartonella immunoblot testing and do Babesia immunoblot testing as well, too. All right. I hope that gives you enough information to share with your physician there. Okay. All right. Good luck to you. Hi, Douglas. Let's see, how long before kidney stones come out of the kidneys? It can vary by person, actually. So if they are giving you symptoms, if you're having back pain or you're getting blood in your urine, generally what you want to do is drink enough water so that your urine is clear colored. And usually over the course of about a week, maybe even 2 weeks, most people will pass those, okay? If not, and if you are still having symptoms, I definitely would want to get a urologist involved. Sometimes they have to run a wire in a little cage through your urethra, which is the tube that runs through your penis, up through the bladder, up through the tubes that go up to the kidneys and snag that out. Or sometimes they have to break them apart using lithotripsy, which is sound waves that will vibrate with the stones and break them down. But the persons that can help you decide if you need further treatment with either one of those methods would be a urologist. Okay. All right. Good luck to you, Douglas. Dawn says d-mannose. Yes, that's from way back when. But yes, it was d-mannose that I was recommending for to prevent recurrent bladder infections. Thanks for pointing it out. I eventually figured it out too. Thanks, Dawn. Hello, Yelena. Let's see. Patient was diagnosed with IGeneX for Bartonella, Borrelia, and tick-borne relapsing fever. She had 1.5 years of antibiotic and herbal treatment, still has some symptoms, 90% to her normal functioning. Does it make sense to retest with IGeneX now and exactly test what we need to do They have Lyme immunoblot IgG, they have Lyme IgX spot, and Lyme screen immunoassay IgG. Maybe it makes no sense even to test. Would tests still show positive for antibodies after bacteria is gone? So I know that a number of my colleagues would not agree with me, okay, but I don't believe in retesting. And the reason is when you're doing antibody testing, even when the infection is gone in chronic Lyme, you can still keep making antibodies against either IgMs. Yes, IgM antibodies, those are the acute ones, but we know 50% of the time when somebody has chronic Lyme, they don't go away. Even though they're supposed to, they don't, okay? So if you still see them, that doesn't mean the infection is there. Also, people, as you know, once you've had an infection, will keep making IgGs. Those are the memory. And so just measuring them doesn't tell you whether the germ is gone. Also, some of my colleagues like to look at the amount of reactivity and how strong it is on the test. So like, is it 1+, 2+, et cetera. And what I would say is that's meaningless too, because a more reactive test may just mean that the immune system is no longer suppressed and is really fully turned on. All right. So more reactivity does not mean more infection. Likewise, it is possible that the antibodies will come back negative, but that could even mean that the germ is just partying on and suppressing the immune system in a way that the antibodies can't be measured. All right. So we don't have a done test. Okay. Now, there is also another type of test out there called an ELISpot test, or I call it a T cell reaction test. It's measuring whether your T white blood cells have seen the germ sometime within the last 2 months. All right. So the IGeneX IgX spot is an ELISpot. There's also Infectolab and Armin Labs have their own ELISpot versions too. And they claim, notice the word I said, claim, that if you measure, if you do one of their ELISpots and it comes back negative, then that could mean that the germ is gone. The trouble is they have no science that validates that. Secondly, having a negative reaction from your immune system could mean that the germs are all suppressed. And then because the germs really are active, the immune system is suppressed because the germs are active. And then finally, the problem with Infectolab and, Infectolab is only looking to see if you have Borrelia for one strain. They're not looking to see if you have the European strains, for instance, and they're not looking to see if you have the 8 strains that IGeneX can with their immunoblot antibody test, okay? So they may just miss it. Armin Labs looks to see if you have antibody or a T cell reaction against Borrelia burgdorferi, Borrelia afzelii, and Borrelia guarinii, so the 2 European strains and the North American strain. But they don't look to see if you have the other 5 that people can get. So again, a negative test on an ELISpot there just may mean that they're not testing for the right stuff. Okay. All right. So in my opinion, there is no reliable way to test and see where you are. You just got to go by what the symptoms tell you. All right. And in my practice, what I usually will do is to try to treat long enough until there are no symptoms for at least 2 months, or to treat long enough that I've tried everything I possibly can to get a person to get better. And if they still remain at a plateau for 4 months and I've added in treatments for persisters, I've changed up antibiotics a number of times, and we're just not getting any better, sometimes I'll say we're done. And with the idea in mind that some of that permanent symptoms that are left may just be due to permanent injury, okay? And in those situations, what I like to do, if they still are symptomatic and I've changed up everything that I can as much as I can, they're still not getting better. Sometimes what I like to do is add in the peptide called BPC-157, which is known to fix damaged tissues, muscles, joints, tendons, neurologic tissue, even immune system can be repaired by BPC-157. And sometimes I'll just do a 3-month trial of that to see if I can get somebody to a better place. Okay. All right. All right. I hope they gave you enough information there, and good luck to you. Good luck to your patient. Hello, Dawn. Let's see. One has mold toxicity, Lyme, Babs, Bart, Rocky Mountain spotted fever, Candida in bloodstream and high EBV, is there an approach that is best, like peeling an onion, doing treatment for mold first before the others, or vice versa? Thanks. Okay, so first of all, I want to talk about the Candida in the bloodstream. So I would assume when you're saying Candida in the bloodstream, what they were really measuring is antibodies. Because if you actually had Candida living in your bloodstream and they found out by doing a culture, you'd probably be dead. It's that bad, okay? You just don't get Candida germs living in the bloodstream. It causes severe, severe illness, all right? But a lot of doctors are measuring whether you're making antibodies against Candida. And the trouble is, we may all make antibodies against Candida. Candida lives in our intestines. And our immune system, because those Candida live in our intestines and many of us just cohabitate with them, they don't give us any problem. Our immune system may still make antibodies, but it doesn't mean we're infected within the bloodstream by them. Okay, so that's a meaningless test to me, basically. All right. All right. In terms of mold toxicity, Lyme, Babs, Bartonella, Rocky Mountain spotted fever, and the high EBV, the main thing I like to do in situations like this is I'm trying to figure out, is it possible that even though somebody tests positive for all these things, and they may, it is also possible that the immune system has the ability to get all these things under control. And maybe the primary problem is just mold toxicity. All right. So I've had people that have come in to see me before that had positive Lyme, Babesia, Bartonella, Rocky Mountain spotted fever testing. And when I started asking them about the history of their illness, what I learned is that they got bit by their tick 20 years ago. They've done fine. And then I asked them about, when you got sick, had you just moved into a new building? Or did your home get a bunch of water damage all of a sudden? Or did your workplace suddenly have a bunch of water damage? I try to do a very detailed history to find out, is it possible that you might have mold toxicity? Because mold toxicity looks just like Lyme, Bartonella, Babesia, etc., because all of those trigger too many cytokines, all right? So when you look at your history, if it's like, yeah, I was doing great, even though I was bit by that tick 20 years ago, and then I moved into this house and there was an aquarium in the back room, and we discovered eventually there was mold in there, and then I started getting sick living in there. Well, I'm not even going to do anything for the Lyme, Bartonella, Babesia, Rocky Mountain spotted fever, because they may not even be the problem, even though the test is positive, because the testing is just looking at an immune reaction. It doesn't tell you whether the germs are still positive, okay? So if the history says it's mold toxicity, I'm going to go after that first, all right? But if it doesn't, I usually would start to treat the Lyme and Bartonella first. And the reason I do that is we know that there's been an observation by Dr. Burrascano, who is one of the Lyme pioneers in this country. In his practice out on Long Island, he found that when people had Lyme, Babesia, and Bartonella, if he tried to treat Babesia before getting Bartonella under control, it became a lot harder to get rid of the Bartonella, okay? So for that reason, when I see this smorgasbord of germs, I usually will go Lyme and Babesia, or Lyme and Bartonella first. And in about 2 or 3 months, as we're getting the Bartonella symptoms under control, then I might add in treatment for Babesia, all right? Once a person is tolerating those things, then I would start to add in binders for the mold toxicity. Keep in mind, whatever you're doing for Lyme will take care of the Rocky Mountain spotted fever. And in terms of Epstein-Barr virus, if it is possible, so healthy people cohabitate with Epstein-Barr virus. And if you were to pull healthy people off the street that say they have no symptoms, you would find many of those people having elevated high titers of antibodies against Epstein-Barr. So finding high titers against Epstein-Barr does not prove those viruses are active in you. It just may mean the immune system is doing what it's supposed to do, keep them under control, okay? But let's say that maybe Epstein-Barr did get active. My approach is go after the Lyme, Babesia, Bart, and mold toxicity first, because if you get those under control, the immune system should start working well enough to get the Epstein-Barr back under control, okay? All right, so anyway, that would be my approach there, Don. Good luck to you. Hello, Maria. Let's see. Hi, Dr. Ross. Do you think Rif machines work? My daughter has candida and mold toxicity, taking lots of binders and supplements and antifungals already. All right. So what I have seen in my practice, so everyone, Rif machines are a device that generates an electromagnetic frequency wave that will, in theory, vibrate with the covering of the germ and burst it. Just like you can take a singer and put them in front of a glass of water, like an opera singer, right? And then they sing really at a high tone and it vibrates with the covering of the glass and it can burst the glass. In theory, that is what a Rif machine can do for various germs. And there are different frequencies that are thought to resonate, vibrate, Borrelia, Bartonella, Babesia, and you can get a device that will generate those waves. All right. So my experience is about 35 to 40% of people that use Rif machines in my practice had some benefit. Okay. Now, it isn't that I recommended they use Rif machines, it's that they were on them and they went and started them on their own. And in looking at that, they found benefit about 35 to 40% of the time. All right. Now, there is a group out of California called LymeDisease.org that is running a research program called My Lyme Data. And they have enrolled, I think the last time I checked with them earlier this year, about 16,000 people now are enrolled in their data collection effort. All right. And so to enroll, you have to fill out a questionnaire. They want to know a lot of things about you, about your illness and Lyme. And then periodically they will choose some of those people to then ask follow-up questions. And about 3 years ago, I think it's 3 years ago now, they did a project where they asked people with Lyme in their database that they selected, which alternative medicine treatments had they tried, and which ones gave them side effects and which ones gave them benefit. All right. And I believe their project showed, I think, 40% for, let's go look at it together. I'm going to do a screen share here. So in my practice, I think 35 to 40% of people get better with Rifing. It's not going to cure you, but it helps. It aids in the recovery. And I think my Lyme data showed something similar. Let me do a screen share here. All right, so to find that article, take a look at this tab over here that I'm hovering over called Key Info. And there's an article I wrote that includes information from my Lyme data, and it's called What Works? Navigating Prescription and Alternative Medicine Lyme Treatments. All right, and in here, I do have this. This is a table. You may not be able to see it well on. Maybe you can. Anyhow, if not, come back and look at this article later. But for the Rif machines is right here where I'm running my arrow. It looks like they're showing 35% of people had moderate to very effective improvements. Okay, on Rif machines. 28% had moderate or severe side effects, though. Okay. So it's not a cure-all. Okay. And so also, if you're just wondering, does medical marijuana help? Well, my Lyme data says 61% of people get benefit from it. Okay. Stem cell therapies, only 3%. And that happens to be what I saw in my practice as well, too. Ozone treatments, maybe about 40% of people feel they get some benefit. Many of you may know, I don't think ozone kills a darn thing. But what ozone can do is it can help your cell energy factories called mitochondria work better. And when the mitochondria work better, you have better energy, so you're going to feel better. Okay. So anyhow, you look at this table, you'll see the different things that people reported benefit or not having benefit from. All right, let me make another comment about ozone. So I know there's a number of doctors out there that say, hey, do your 10-pass ozone therapy. It's going to kill all your germs. It's a bunch of malarkey, actually. And let me tell you why I'm saying that. So one of the biggest proponents of doing ozone as a means of treating a number of conditions like Alzheimer's disease, other illnesses, is a European researcher. And he actually ran an experiment where he took a test tube full of germs, he put ozone in, and it killed all those germs. That's great. I mean, so therefore, maybe that means it's going to kill Lyme. All right. If you then take that same test tube and you put the germs in, and before you put the ozone in, you put just a small amount of blood, a drop of blood in there, and then you put the ozone in, no killing at all. The reason is your blood is loaded with antioxidants that get rid of the oxidizing killing effect of ozone. So in our bloodstream, where that 10-pass ozone is going to, and it's going to be, the killing effect is going to be obliterated by the antioxidants in your blood. But ozone results in better oxygenation of your cell mitochondria, and therefore you might get better energy as a result of that. Okay, so don't be confused when you do ozone to think, I feel better, must be killing germs. Probably not. It's probably because it's helping your mitochondria work better. Okay, all right. Maria, good luck to you. All right, here we go. Let's see. Question from Lisa to admin only. Thank you for your kind support with the Lyme community. Rock. Thank you. I appreciate it. I have had IGeneX, confirmed IgG, Bartonella, Lyme-literate, Vinsoni, and IgM Babesia with Lyme immunoblots negative, but some suggested bans on IgG. Do the indeterminate bans likely mean I have Lyme, but it is hiding? Also, when I try my perceived medicine, amoxicillin and Biaxin for treatment, it causes intense Herx reaction and elevates my D-dimer, which I believe is causing collateral damage. Are there any herbs that you believe will work just as well? Is my husband at risk of catching Lyme from me, or is it a higher risk if he was affected and I was not? There's a lot of questions there. Okay, so let me look at... So it is possible to have Babesia and Bartonella and not have Borrelia, all right? So ticks can be infected with a number of germs, and not all ticks that are infected with Babesia and Bartonella are also infected with Borrelia, okay? Just to answer that, okay? But on the other hand, it's possible when you have Babesia, Bartonella, and Lyme, or even Lyme by itself, that there's enough immune suppression going on that you get those indeterminate reactions on the immunoblot. So the indeterminate may mean there is infection there, but the immune system may just be damped down enough, suppressed enough that it can have a strong enough reaction. And often what will happen is as you treat the infections, you go back and test in 6 months, you'll have a stronger reaction because now the immune system can react. There's not as much immunosuppression going on. Okay. All right. And then let's see. So one thing to look at for that elevated D-dimer means you're getting into some blood clotting or thickening, all right? And so one of the things that when you have chronic infection, one of the reactive things that the immune system can do is make more of a blood clotting protein called fibrin. And that fibrin can kind of thicken up your blood, all right, which could lead to some of the elevated D-dimer test. One thing you could try to do is to break down that fibrin. And the enzyme, which is known as lumbrokinase, which is a group of enzymes that come from the skin of earthworms, can sometimes be very effective at helping to break down that fibrin, all right? And so you could use lumbrokinase by Allergy Research, which is a 16 milligram pill, or you could do a product called Baluki by Canada RNA, which is a 20 milligram pill. I think they're both as effective, even though there's a different milligram strength there. But you take either one of those twice a day, and you might get make it so that you're not getting that elevated D-dimer test, even if you stay on prescription antibiotics. So run that by your physician and see what do they think about using lumbrokinase to help with that elevated D-dimer, okay? And then in terms of let's see, you're tested positive for Bartonella, Babesia, and you may have Borrelia. What you might look at, if you could try an herbal protocol. Okay, now herbal antibiotics for Borrelia can have a chance of working just as well as prescriptions. All right. Herbal antibiotics for Babesia have about a 5 to 10% less chance of helping. And herbal antibiotics for Bartonella have about a 5 to 10% chance less of helping than prescriptions. All right. But you may be one of the people it works in. Okay. So a regimen you could look at that would cover for Bartonella and Borrelia and Babesia could be to do a 2 herbal antibiotic regimen. Well, actually 3 things. I would do a Cryptolepis, and I would do a Japanese knotweed. Okay, Crypto can treat Babesia. Crypto also can treat growing and persister Lyme, growing and persister Bartonella. And then the Japanese knotweed can treat growing and persister Borrelia, growing and persister Bartonella. And then add in some cinnamon clove oregano, liposomal cinnamon clove oregano, and you get killing of growing and persister Lyme and Bartonella, growing and persist, well, both of them, okay, but you also get breakdown biofilms, all right? So that's something to think about as well, too. And if you're looking at how to use that, well, that you would do 1 pill twice a day. For Babesia, I'd like to use Crypto at a teaspoon 3 times a day. And my Japanese knotweeds, when I'm using it, you can either go 30 drops twice a day, or if you want to go stronger, you can even go up to half a teaspoon 3 times a day. Okay. All right. There you go. Good luck to you, Lisa. Hello, Don. Let's see. Which co-infection can cause small scabs on back of head and scalp, not eczema or rash? None of them. Actually, I would say is known to give small scabs in just a specific area like that. I would wonder about seborrhea dermatitis that I mentioned earlier. That sometimes can lead to some scabbing back there too. But to give you the best thought, I would have to look at it. And obviously, I can't do that in this format. Okay. I hope your doctors have taken a look at that and have given you some opinion as well too. Okay. All right. Good luck to you, Don. Hello, Charles. Hello, Dr. Ross. After approximately 4 years of treating for mold, Lyme, and Babesia, I started to feel good enough to do some exercising, jogging up to 3 miles. I recently took lumbar kinase and got thrown under the bus. Major pain and cannot exercise. My question is, does the mold have anything to do with this reaction, or is it just that the bacteria being affected by the lumbro? 4 months ago, my mosaic mycotoxin test with glutathione challenge was still high. All right, so the lumbar kinase, I don't think would have anything to do with the mold toxicity, but the lumbar kinase could be doing a couple things. So even though I know you've been feeling better with the Lyme and the Babesia, they may still be in you. And the lumbar kinase regarding Lyme can break up biofilms that are covering the germ, exposing them more to the immune system or antibiotics if they're on board, and you can get Herxheimer's from that, okay? And the Babesia, what lumbar kinase can do for Babesia is there are certain strains of Babesia that have the ability to wrap themselves in your fibrin, the blood clotting protein fibrin, and then they, wrapped in fibrin, they stick themselves on the blood vessel walls, and then they hide from the immune system, right? So if you start breaking down that fibrin with the lumbar kinase, that exposes the Babesia, which means your immune system can attack it better. Or if you're on antimicrobials, the antimicrobials will kill it easier too, and you get Herxheimer reaction, all right? So it's probably more related to the infections than it is to the mold toxicity, okay? All right. Good luck to you, Charles. Hello, Tyler. Let's see. Hi, Dr. Ross. What are your thoughts with regard to the risk of developing kidney problems such as acute renal failure when using rifampin? I've seen studies cited that claim problems can come particularly with intermittent administration. Is there anything we can do to protect ourselves from these risks when using this antibiotic? So that's interesting. I don't think, all right, so rifampin is removed by the liver, actually, and we tend to think of it as giving liver problems. I haven't seen anything, or I haven't seen anyone in my practice using it over the last 20 years that developed any kidney problems at all. All right. Now, bear with me. I'm just going to look up that real quick because I haven't seen it happen before. I have seen it lead to liver elevation. So hold on here just a minute. So what I'm seeing here quickly, and I'm just reading quickly, is it's a very rare thing that happens. And that's probably why in the 20 years I've done it, I've never seen anyone with a problem. Okay. So anyhow, the only thing I would look at is probably, talk it over with your physician. If you have a lot of fear of using it, this may sound hokey pokey what I'm about ready to say, but if you have an intuitive sense that this drug is wrong for you, don't use it. Trust your intuition. All right. But if you're doing this just because there's a few articles that cite a few people having problems, again, I would reflect that in 20 years of treating people with lots of rifampin, I never saw anyone develop kidney problems on it at all. It's a rare thing that can happen. Okay. All right. But my other point is, if you have an intuitive sense that something's not right for you, then don't do it. All right. If you read those scientific articles and it said, that's going to happen to me, trust what your knower is telling you and don't do it. All right. Good luck to you, Tyler. Hello, Curtsy. Let's see. Hi, Dr. Ross. I started doing a bit of reading, meta-analysis of studies showing long-term changes in gut microbiota from many different antibiotics. And there's another part here. And I'm wondering why, if herbal antibiotics work well, why don't you just recommend those? How do you decide? Is there a concern with acute Lyme that we should just do doxycycline because it's easy? All right. So, I have evolved the longer I've worked in treating Lyme, and also based on the data that has been evolving. There's been a rapid boom in research about the importance of the gut microbiota. If you look at the last 5 years, there's been an exponential growth in science coming out showing us the importance of the gut microbiota. Healthy microbiota, healthy balance of parasites, bacteria, yeast, worms, all the stuff that lives in our intestines. That's the microbiota. Having a healthy balance of that microbiota is very important for maintaining a healthy immune system, brain function, gut permeability, at removing toxins, getting rid of things we're allergic to. It's like the intestines are a whole other organ system. The germs that live in the intestines are a whole other organ system. We get a lot of benefit out of them. Okay. So based on that, within the last few years in my practice, when somebody comes to see me, we're starting to treat, I recommend they start with herbal antibiotics. And I see how well we can get with those. All right. Now, not everyone's going to respond. Even though most people can, that doesn't mean everyone will. And so I usually recommend starting herbal. And if we're not getting far enough, then going to prescriptions. All right. That's what I do in my practice. Now, I also believe strongly that all of us have a sense of what's going to work best for us. All right. So in my practice, I pitch ideas. I say, we could do these herbs, and I give them a 90% chance or 85 to 90% chance they're going to work. And I give the prescriptions an 85 to 90% chance to work. These are the prescriptions antibiotics we could use, but you got to be aware there's a risk it could injure your intestinal microbiota. Which one do you want to do? And when I'm asking that question, I'm trying to tap in to a person's own intuitive sense. And if they have a strong sense, if they tell me, doc, herbs never work for me and I want to go the prescriptions, I say, fine, okay. But we have to tap into what people want to do as well, too. So anyhow, those are my comments on that. Okay. All right. Good luck to you. And thanks for raising that, too. Aha. Sandy, thank you for saying that. So earlier when we were talking about the Cowen protocol, I said I couldn't remember the name of a TOBA on Nutrimetics product. It's called Banderol. All right. Sandy just pointed it out to me, or probably pointed it out earlier, but I'm just getting there to her comment. All right. Thanks for saying it, Sandy. Hello, Mary. Let's see. Hi, this is Mary. I have never heard you mention Dr. Bill Rawls and his herbal protocol. Is there a reason why? No, I mean, there's not a reason I don't recommend him. It's just that Dr. Rawls has tried to put a lot of herbs into his formulas, and there's some weaknesses about the Rawls formula. So first of all, I tend to be a person that doesn't like using compounds that have a number of things in them. And the reason is you're not going to know what you're reacting wrong to if you start having a reaction, okay? The second thing is the Rawls protocol is weak in terms of what it's offering for Bartonella, and it doesn't even offer really anything for Babesia. So I think there are stronger herbal protocols to use than Bill Rawls. Now, I will admit there's some simplicity in taking his products because he boils it down to about 4 different kind of pills you can take, and that's simple. But I would say on the Bartonella Babesia side, in terms of his herbal antibiotic program, I think it's weak. I don't find it to be strong enough, actually. Okay. All right. Thanks for the question. Hello, Curtsy again. Let's see. Next question. You recommend the Mito food plan as a good diet for Lyme. I recently discovered another diet called the Bresden protocol or KetoFlex 12-3. I even heard the Mito food plan referred to as a MitoFlex. All right. Let's see if there's another part to this. Are these the same diets? I don't know. I haven't actually looked at them directly to tell. What I would say is anything that is keto or paleo that also is built on a lot of plants is good. All right. The plants are going to give you plenty of fiber to keep a healthy, good gut microbiota going on. Okay. We know that using various fiber is what's going to maintain the good microbiota. And maybe even in the face of antibiotics, you can help your microbiota do best by being on lots of plant fiber. All right. And then the other thing that's nice about it is, and I'm calling these plant forward, they still have some meats in them. It's just that they heavily emphasize plants, okay? And so either one of them could be good. I don't know the specifics, but anything that is a plant forward paleo keto diet is probably going to be beneficial, okay? All right. Good luck to you. Hello, Pam. Let's see. Dear Dr. Ross, thank you for your help. I was treated for Lyme with 100 milligram doxy for 10 days, then Rocephin for 21 days. Then Igenix said Bartonella and tick-borne relapsing fever in Florida, ? Then treated with 250 azithromycin 10 days and methylene blue for 6 months. No help. New doctor prescribed ampicillin and Bactrim biocidin. Had never heard of lumbar kinase or natokinase, but he is supposed to be Lyme-literate. Doctor, should I be worried? Is ampicillin the same as ampicillin trifolate? All right. So hold on. I have to go back through and read this again. All right. So first of all, I know what the testing is showing. I would want to know symptomatically what is happening with you. So in other words, are there enough symptoms that still say Bartonella? Are there symptoms that say Borrelia? What do the symptoms suggest that could be there? Okay. I would need to know that in terms of trying to give you a recommendation of what antibiotics to use. Ampicillin is equivalent to taking amoxicillin. And ampicillin and amoxicillin are only useful for treating spirochete Lyme. They're not useful for intracellular Lyme. They are not useful for cyst Lyme. Bactrim can treat intracellular Bartonella, may help with intracellular Lyme, and that's about it there. The biocidin could pick up spirochete and cyst Lyme, and is great at breaking up biofilms. So by the time you look at using ampicillin, the Bactrim, and biocidin, it may be good enough to cover your various germs, all right? And if you're on the biocidin, you don't necessarily need to be on liver kinase and nattokinase, because the biocidin, in addition to killing Lyme, also can treat biofilms too, okay? Also, the oregano that is in biocidin would help with persister Lyme as well too. Okay. All right. Good luck to you, Pam. Hello, Don. With ashwagandha being a nightshade, do you see that being an issue for some people? How does one know? What are the symptoms? So nightshades, everyone, are a group of vegetables and plants that may lead to more inflammation. That's what the theory is, at least. Okay. So as a nightshade, it's possible ashwagandha could. I have rarely seen that happen. And how I look at that is, if somebody introduces in ashwagandha and they get more achy, maybe coming from the ashwagandha. Okay. So that's how I've used it to make my decisions, basically. All right. All right. Good luck to you, Don. Let's see here. Dawn says, does IGeneX also test for Asian strains of tick diseases? I don't know specifically the Asian strain. I don't know. I don't know that off the top of my head. I'd have to look and see. There's 8 strains they do test for, and I'm not familiar enough with some of those strains to know whether they're the Asian strains or not, because I haven't had to worry about that or where I practice, so I didn't look into it. So I don't know the answer to that question. Okay. All right. Hello, Jeff Samantha Young. My daughter, 20 years old, diagnosed with Lyme disease and started on antibiotics. Started in medical because migraines 5 weeks ago. Hospital she's in had nothing helpful after several tests and MRI. Seek testing for Bartonellosis. All right, so things that can lead, I think you're saying she's got bad headaches, and that's how I'm interpreting your question here because of the migraines. So I would look for Babesia, actually. Babesia is known to give bad migraines and can give a lot of headache problems too. Bartonella sometimes, but when I see people with severe headaches, I'm looking for the possibility of Babesia, actually. All right, so a way to test for that would be through IGeneX using their immunoblot method, to look to see if she has Babesia. Again, their immunoblot can look for a specific strain. They're looking at antibiotic reaction or antibody reactions against 2 specific strains, which are Babesia microti and Babesia decani. And in addition, the whole family of Babesia, which may be 15 to 20 strains that can infect humans, of which one that may be a more predominant factor is a strain called Babesia odicoli. they don't have the ability to distinguish that one specifically, but the way you look to see if you might have it is if the family test, the species test comes back positive, then that could mean you have Ota coli or one of the other strains. Okay. All right. Good luck. Yelena says, "Thank you so much for your detailed answer. It is really helpful." You're welcome. I hope that gives you some help, and it sounds like a patient possibly too. So good luck there, Yelena. Hi, Douglas. Let's see. Some say viruses have to be cleared before Lyme can get better. True or false? I disagree. I would call it false. I think I kind of partially gave a response to this earlier, an explanation earlier. So I know a number of my colleagues will, at the beginning of treatment, will always test to see if a person has elevated antibody titers against Epstein-Barr, HHV6, cytomegalovirus. All right. And under the idea that if the antibodies are elevated, that may mean these common infections that healthy people cohabitate with. I need to point that out. These are common germs that are found in healthy people. Healthy people can cohabitate with them just the same way we live with bacteria in our skin. Their immune systems keep it under control. Okay. So it is possible that when you have Lyme and tick-borne infections, that these germs may get more active. It's possible. The trouble is we don't have accurate testing that tells us if they have. Okay. My approach is to not even test for them. And what my approach is work on getting your tick-borne infections, your mold toxicity under control. And if you're about a year into treatment and you're not getting much better, then come back and look at whether somebody tests positive with the antibodies against the viruses, just to indicate whether they could be in them or not that they're active. But if they do test positive and going after the tick-borne infections hasn't made a difference and mold toxicities have not made a difference, then I might add in antiviral treatment for chronic viruses. All right. That would be what my approach is with that. All right. Keep in mind, by getting your Lyme and tick-borne infections under control, mold toxicity under control, even if those viruses are active, the immune system should kick in and put them back under control again, because the immune system is designed to do that. All right. Because again, we know in healthy people that they have elevated titers all the time against these viruses, and the viruses aren't bothering them. Okay. All right. All right, everyone. That's it for me for tonight. Douglas, thank you for that last question there. I appreciate that. So take a look at your email tomorrow morning. And we'll go ahead and I'll try to get that out to you before 9 to 9:30 a.m. Central Standard Time, Austin, Texas time. Sometimes it's a little later than that, but that's generally what I shoot for. And in that email tomorrow morning, you'll have an opportunity to sign up for next week's webinar. And also in that email tomorrow morning, you'll have another opportunity. Hold on here just a minute. I can do a quick screen share to show you that other opportunity. So you'll also have an opportunity to sign up for LymeUNITED. All right. So this is our new membership group. I think many of you are familiar with this, but this is where you can get help from me on a regular basis and other members that have Lyme. In here, we have many different forums. Member-to-member forum where members can talk with each other. There's one where people post all of their wins. There's another one called Office Hours with Marty Ross MD, where every day I write responses. I take about an hour and write responses to as many questions as I can. In my Ask Marty Ross MD Live, it's a Zoom room setup where actually people tell me their questions directly, and I can ask them questions back and forth and give them a better response. And then we have a new section called Unities Take Charge. And this is a forum where members are actually starting to do their own presentations too. Okay. So I hope you'll join us. All right. And if you do want to join us in tomorrow's link email, you're going to get a link in there that gives you access to this page, which is read through it and see if LymeUNITED is right for you. And if it is, you can either click on this Join Now button here, or there's a Join Now button somewhere down here at the bottom, another Join Now button down here, okay? But read through it, see if it's right for you. But we're looking for members to help our community thrive, and I hope you'll consider joining us there, okay? Let me go back here again. All right. So that's it for me tonight, everyone. Good night. I hope everyone has a good evening, and glad so many of you are here tonight too. Bye-bye.